Today we are having the celebration, the launch of a very important international collaboration that Ramaiah Memorial Hospital is entering into with the famous Mount Sinai Hospital, Mount Sinai International Health System in New York. We have with us Dr. Dorotovics, Sabi Dorotovics, Dr. David Reach, Mr. Gianelli, Dr. Sharma, all of them representing the Mount Sinai International Hospital. Of course, you know our Honorable Chairman, Dr. M.R. Jairam. We will briefly explain to you the contours of the international collaboration that we have entered into. Last year, we began this process of negotiating a collaboration deal with Mount Sinai International. The intention was to see that our Ramaiah Memorial Hospital sets up a number of centers of excellence in various super specialties with the help of a very well-known, highly reputed healthcare system of the Mount Sinai International in New York. We have entered into a 10 years long collaboration with their system, which began on the 1st of July. So the collaboration will involve setting up centers of excellence in various super specialties in our hospital, including cardiology, oncology, nephrourology, neurosciences, gastroenteritis specialty, and transplant medicine. To begin with, we will select a few of these specialties for focus, and as we go on in the process of collaboration, this will extend to the other specialties also. Along with this, we also have agreed that we will co-brand our services. MS Ramaiah Memorial Hospital will perform its services in affiliation with Mount Sinai International. This would mean that Mount Sinai International will help us in maintaining patient safety standards and quality of service throughout the period of collaboration for all the specialties in our Ramaiah Memorial Hospital. This is in addition to their helping us in the selected super specialties for setting up centers of excellence by exchanging their clinical practices, protocols, along with our clinicians in the Ramaiah Memorial Hospital. As you probably know already, Mount Sinai International and Mount Sinai Healthcare System is a very large establishment in New York. They have 8 large hospitals in New York, employing over 7,000 clinicians on their establishment, and they have virtually all the specialties and super specialties for clinical care. They have a history of over 150 years of providing healthcare services in New York, having been established as a hospital in 1852.
Great to meet all of you. I would like to start with stating that our leadership at Mount Sinai Health System in New York is very proud and honored to be able to form this long-term partnership with Ramaiah, because Ramaiah and Mount Sinai shares a common mission of finding ways to best serve our patients, provide the best quality care, and strive for the best outcome. In that quest, we forged this relationship to establish and help improve healthcare processes, clinical care processes in multiple specialties, including cardiovascular care, oncology, and other areas.
It took us about 1 year to get to here after the first meeting back in New York, and I'm very glad that Mount Sinai actually is the first affiliation of Mount Sinai with any medical center in India. So very proud of it. From Jaipur, and I'm working Mount Sinai since 1988. So to see this collaboration, so just to simple terms, of course, besides the quality which will improve, is the both technology and skill improvement. Skill set. What does that mean? Any technology, many equipment, many machines which are available outside and now they're available here in India. Which one to get? What is the best one? Knowing that we use them, we'll give the right advice. And the second is, you have the machine, but you need the skilled people. So skill, I would say, is the equally important of this affiliation, which will be both ways. One, most important, that experts from here visit Mount Sinai and get trained on those technologies, the new machines which will be coming. So rather than get a learning curve, you start right from the top. Get experience, let's say from my point of view, the valve replacement. So top doctor from here come to Mount Sinai, get a training in 1 month, and then come back and implement that skill.
And luckily, without research and newer things can happen, nothing will move forward in health. For example, when COVID came, we took all the land and took the vaccine as a thing. That protected so many people. Maybe there are controversies, there are issues, but it did protect some people. But the question is, today Indian research needs exclusive partnership with some people who are leading in the research. They are huge leaders in research. Equipments, devices, protocols, algorithms, all that will be shared with us. That's the big advantage as a doctor I am finding for the population of the country, which will be a game changer. I know that all that happens in New York cannot be transported, copy and paste won't happen. What happens there best, we need to customize it to our situation, which they are willing to help us to develop, seeing our thing.
See, research is you have to create something. So creation of something can come from anywhere. It cannot be only one place, or it is not. It is not localized. So research can, anybody can take up that issue. They can solve those problems. Solving problems is nothing but research. So they have done that. That art of research has been going on for a very long time. We have started this after all in recent times. So we have to learn from them.
Yeah.
So this is a learning curve for us. See, we are still new. They are already 150 years old. See, we have after all we have started all this. We have DM courses from how many years these DM courses have come in, or MCH courses very recently. So this is a learning curve for our students to get into that mindset of research and all that. This is how our DM students and MCH students become more proficient and more better doctors.
It gives me great pleasure to be here because this is a wonderful occasion. I think simply put, two great institutions are coming together, and I think Mount Sinai could not have found a better partner than MS Ramaiah to start this initiative. MS Ramaiah is an iconic institution of Karnataka, and not only in Karnataka, it's known across the country because they were the pioneers in medical education long ago. And people from all over India, they used to come to this institution to study, and there used to always be a competition, a beeline to somehow make it to this institution.
I would like to tell the office bearers of the Mount Sinai Hospital, the MS Ramaiah was a great philanthropist, and this medical college was started in a private sector when there was a very dearth of the medical colleges, medical seats in Karnataka as well as in India. At that time it was started. From all over India, people used to come to this institute for this hospital, and they are also running the hospital. Few beds they have kept it for the poor people. They used to treat poor people freely from those days when it was very, very costly. So that is the philosophy of Sri MS Ramaiah, and Sri Jairam has continued it in the same manner. That's why we have so much respect and regards for him. And also I would like to tell, yours is the one of the best sixth hospital in US. But if you take MS Ramaiah Institute only in private sector, other than AIMS and other things, MS Ramaiah College may rank around 6th or 7th in India. If you all put together, if you calculate, if you consider all other government institution, All India Institute of Medical Science and such things, then their rank may little go up, but otherwise in a private sector itself, their ranking may be around 7th or 8th, I believe.